Wash your hands.
Hi,
Pull the curtain.
how are you?
Hi.
I'm Amy, a student nurse with Barb here today.
Hi.
Yeah, I'm the primary nurse. You are Kaylee's?
I'm Kaylee's sister. I'm Adriana.
Hi.
Hi, nice to meet you guys.
Kaylee, are you still having the pain?
Yeah, it's still about a 2 to 3, kind of burning, aching.
Okay, well we came back with that ibuprofen. Can you tell me your name and date of birth?
Kaylee Link, 7/4/1986.
Okay, perfect.
Kaylee, what brought you here to the hospital?
I was playing with my dog and she jumped up on me and kind of scratched my leg, and I ended up in the ER. Thank you.
Yes, this ibuprofen will help bring down some of that swelling and reduce that pain for you.
But yeah, so it just ended up developing after that. I tried to keep an eye on it for a few days and it just got worse and worse.
Okay. And you're a diabetic too, right?
Yeah.
Okay.
Here, I did print off some of the information about cellulitis.
Oh, perfect.
And what did you give her for meds?
Ibuprofen, 400 milligrams.
What does that do?
Tabs. It reduces the inflammation, reducing pain.
Okay.
So this is what we're looking at here.
Okay. And what causes cellulitis?
In Kaylee's case, her dog scratched her leg,
Okay.
breaking the barrier in her skin, and her normal flora caused an infection. Since she's diabetic, she's more prone to infections and not being able to fight them off as well.
Okay.
It was probably caused by typically a staph or a streptococcus microorganism.
Okay.
I'm going to just check your pulses here. Good. And your refills are good. Can you?
Can you feel that?
Yep.
We have to be careful because you're a diabetic and they can have.
Yeah, I know when I go
Lots
for
of
my
feeling.
doctor's appointments, they check that a lot.
Okay.
Good. You wiggle your feet a little bit? Does that cause any pain or?
Nope.
No? Okay. Your color looks good. The redness has gone down.
Yeah, I thought it would take a lot longer because of my diabetes, but
Mhm.
I've been trying to really increase my protein and vitamin C in my diet to try and help.
I bet that's that's what's been doing it. Good job.
So why do you guys mark, what's the markings on her leg for?
We mark where the redness was to begin with, and we can see with Kaylee that it has shrunk, so it's getting better. It would also tell us if it had grown outside the lines that it was getting worse and we needed to change things up a bit.
Okay.
But it is getting better, so
Yes.
Alright, I'm just gonna measure your calf again. Go ahead and relax.
Be able to go home before you know it. And your
Hopefully.
antibiotics almost done.
Yep,
so.
and that's also going down the swelling around the calf, so that's another good indicator that we're healing and going in the right direction.
Good. Is this all the antibiotic that I'll need, or do I have to go home on anything, or?
We'll finish this one up, and you will go home on an oral antibiotic.
Okay. So once I start seeing the redness go away, then I can quit taking it?
You're gonna wanna keep taking that antibiotic until the full prescription is gone.
Oh,
Do not stop taking the antibiotic when you feel better.
Okay.
And make sure if you touch your leg at all to wash your hands to prevent further infection.
Okay.
Or if any of your helpers at home, like your sister or,
Yeah, I
Whoever
know my
helps you
husband
with
and my
that.
sister are gonna help me a lot with just house stuff and trying to get my leg back on track.
yep, so just make sure you're washing your hands before and after touching, if you're helping her wash or whatever you need to help her with. Also, if you notice that it is more red or swollen or painful or warm, that you'll want to contact your primary care provider, because
Okay.
that would be a sign that things are going in worse direction.
Okay.
Do we need to cover it when we get home?
It
Wrap
should
it?
be it should be fine, open to air
Okay.
right now.
Okay,
Yep.
good.
Good deal.
Right, any other questions?
Not at this time.
All right, here's your call
Thank
button.
you.
If you need us, you can just hit it. Can I get some hand sanitizer?
Yes.
Thank you. All right.
Thank you.
Thank
Nice
you.
to meet you.
Nice to call.
Thank you.